So this is the bridge taking you back into the United States. It's pouring down rain. Sadly, I forgot to click record when I was leaving her clinic because I wanted you to see just how close it is. But from where I'm standing, her clinic is about 4 minutes walking straight that way. So it's very, very close, very safe. What? Oh no, I had lipo on my arm. Yeah, with Dr. Amaya. Yeah, right down the way. It went great, no issues at all. Huh? Yeah, I had it this morning. Oh no, it doesn't hurt. It doesn't hurt. So this is the way back. So a couple of things. Security, of course. With Dr. Amaya, she's been doing aesthetic surgery for like 20 years plus, I believe it is. Hold on one second. So to cross the bridge, you have to pay. So hold on one second. Buenas noches.
Aquí.
So to cross over, you have to put your money in.
It's okay. It's okay.
¿Está bien?
Sí, está bien.
Gracias. So to cross back into Mexico, you have to pay $1 to walk on the bridge, and that is to and from. So back to my experience. Dr. Amaya's been practicing aesthetic surgery for about 20 years, and she is board certified. Unfortunately, there are a lot of doctors here in Matamoros who are like family doctors or general practitioners, and they may have taken a weekend class in lipo, and that's kind of how you run into so many people having complications. But Dr. Amaya's been doing her practice for 20 years. She's extremely knowledgeable, extremely well trained, and I've trusted my life with her 3 times now. All the nurses that took care of me today are the Mexican equivalent of what we know in America as registered nurses. They did go to nursing school, and they are registered with the equivalent of the Mexican Board of Nurses. The medicine that I got throughout my stay was the same medicines that I've given on a daily basis in America. Like I said, I am a registered nurse myself, so anytime I've went to another country and had anything done, I have always graded them on a registered nurse's perspective. And a couple of the drugs that I got during my intubation, the anesthesiologist showed me. I got Versed and I got fentanyl, which I give both of those very often in the emergency room. And then during my stay, I was given a couple of rounds of Recephin and Toradol. Toradol is a non-opiate, non-addictive, anti-inflammatory, a lot stronger than anything we can get over the counter. And for me, it's worked out very well. So these 2 gentlemen up here, I've got to show them my passport, so I'll put you on pause. Hold on. All right, so yeah, you have to show your passport. You have to show your passport a couple of times. You have to show it to those guys, and then you have to show it to immigration that's right down here. The length of the bridge is actually about the same distance it is to get to Dr. Amaya's place. So all the medicines I got while I was in her clinic were IV, and I got a couple of boluses of normal saline, which again, same thing I use on a daily basis at my job here in America as a registered nurse. I've been to Dr. Amaya 3 times, and every time has been the same. It's been wonderful. No issues whatsoever. I think I need to cut my phone off to go through immigration, so hold on. All right, so I'm back. I don't even know what I was going to say. Oh yeah. So one of the things that I like very much about Dr. Amaya that I don't see that much in America, unfortunately, is in my discharge packet, along with my prescriptions and discharge information. Hold on one second, it's too loud. Alright, so in my discharge packet, Dr. Amaya lays out a specific vitamin regimen that she wants all of her patients to follow. And I have a lot of respect for that, because unfortunately in America, doctors have gotten away from nutrition and just, they want to give pills for everything. But I know that one of them is vitamin C. I know that one of them is zinc, off the top of my head. And I learned in nursing school those are very important for any kind of wound healing. When I've had surgery done in the United States, there was no vitamin recommendations or anything like that. So, you know, I think there's a couple of things to keep in mind when coming to other countries. I had a facelift done in Turkey, and I've had my butt and body done in Mexico. And I will say that both in Turkey and in Mexico, there are some things that's different. But just because something is different does not mean it is wrong. Some of the equipment they use is a little bit different, but it's not too different than anything that I don't recognize, that I haven't seen in my 9 years in the hospital. I know that there's this big stigma that going to other countries for surgery is a mistake, or that it is dangerous. But I want you to keep one thing in mind. As far as having surgery in other countries, America is has the highest maternal death rate of any developed country in the world. So obviously we don't have that down. So just something to think about. I think it's all about knowing the quality of the doctor, their background, their experiences, of course patient recommendations, infection rates, things like that. You know, I showed you Dr. Amaya's clinic. Everything is very clean. She has a housekeeper that mops and keeps things very clean. There seems to be a handyman on site as well that's always painting or fixing something to keep everything looking nice and clean. So that's kind of my experience. I love my lips. Someone may be wondering why I went and had fat put in my lips rather than filler, and that is because in America, filler can cost you anywhere from $600 to even $1,000 a vial, depending on who does it and where you get it done. And most of those are only going to last a year if you're lucky. So if you're someone that gets filler quite often, or you really like the way that filler looks, and you're going to be getting it for the next 4 or 5, 6, or 10 years, think about how much money you're spending on that versus you get your own fat put in your lips. And of course a little bit is going to dissolve, but anywhere from 60 to 70% of it is going to stay, and that's your own fat, and it's permanent. So that was kind of my philosophy, and I don't have any regrets, any complaints whatsoever. So if you'll give me a second, I will show you my discharge papers. Alright, so this is my discharge packet. It got a little bit wet on the way here. This is where she wrote me a prescription for Valium, which I got filled. This says post-lipo and BBL care. Painkillers and anti-inflammatory. This medicine right here, the same medicine I give in the emergency room almost on a daily basis. It's part of sepsis protocol. Vitamin C, protein shakes, electrolytes, and on the other page it has another list of medications as well. And that, you know, anyone that believes that there's other ways of healing rather than just taking a handful of pills, you may have a lot of respect for a doctor that still recommends vitamins and nutrients as a part of healing. I've never had that from a surgeon in the United States, unfortunately. But I'm gonna find me a lift and get to the airport. I highly recommend Dr. Amaya. Like I said, I've trusted my life 2 or 3 times. I've never had a complication. I've never had any issues. If you have any questions, send her an email, or you can try to ask me and I'll answer them the best I can. Thanks.